Pigmentation in the private parts and underarms is what a lot of women suffer from. I am Dr. Shilpa. I am gynecologist practicing in Andheri West in Mumbai. These are the issues that we face commonly. We talk about the pigmentation, though the skin of the private parts and also the underarms is 2 shades darker than the original color. This pigmentation is a normal pigmentation. So keeping the expectation realistic, knowing why it is happening is very important. We can divide the pigmentation that is happening in 2 reasons, like one can be the physical reasons and another can be the hormonal reasons. In the physical reasons, if the lady is towards a heavier side on the weight, walking, moving the hands, friction between the thighs, friction with the arms can cause the pigmentation. It can also happen with the scars, like acne scars. The infection that can happen on the private parts or on the underarms can also cause pigmentation. Other reasons which we can think about are the hormonal reasons. It can happen because of pregnancy, it can happen because of menopause, it can happen in the puberty age, it can happen when you are on a birth control pill, it can happen because of certain metabolic problems, like in PCOS we get it, sometimes in diabetes we get it. So practically any hormonal changes, any metabolic problems, all can cause the issues with the pigmentation. How to handle pigmentation? First thing, as I told you, knowing the reason is very important. Lifestyle correction, losing weight, avoiding tight garments, using breathable garments goes without saying. Then the investigations to find out if there is any associated issues. If it is because of birth control pill, we can opt to stop it. If it is happening because of metabolic problems, then it has to be correctly investigated and treated. Though with the metabolic problems getting treated, it is easier to get it corrected. Now, if we have corrected whatever necessary and still the pigmentation do persist, or whatever the primary reason is, we want it to get fine, we offer various treatment options for hyperpigmentation. The treatment options can be in terms of the tablets. There is tranexamic acid that we use to decrease the pigmentations. Sometimes we give the antioxidants that also helps in decreasing the pigmentations. We can give an option of certain creams which gives only superficial peeling effect that causes the new skin to form and is not pigmented because the exposure is out. We can also give an options of peels, which is like glycolic acid peels that causes the superficial skins to wean off, but the private area skin is specifically very sensitive, so getting it done under the supervision with the right concentration is very important. Now, when the pigmentation happens because of hormonal thing or continuous friction, it goes to the deeper layers, not even the superficial or a deeper layer. For that, we also have a laser treatment, opting for a pico laser, which is the most advanced laser that helps in breaking the pigmentation even in the deeper layers of the skin. We have Q-stitch laser, but out of 2 lasers, now we prefer pico laser for pigmentation. The treatment will depend upon the area that we have to cover. It can range from 5 minutes to 30 minutes on an average. Few taking care points that you have to avoid friction, you have to avoid swimming for some time, no sexual intimacy for 48 hours. Taking care of the area and hygiene is important. So basic care that we will explain you after the laser. If you want to know about how we can manage the hyperpigmentation, you can directly contact me on the number given below. Thank you.